Hello, my name is Nurse Pauline RN. Welcome to my channel. The goal of my channel is to assist nursing students to be successful in their fundamentals of nursing exam. The topic of my video today is taking manual blood pressures. Before taking a manual blood pressure, please assess your patients for pain is the fifth vital sign. Pain elevates blood pressure. Know what size cuff your patient is going to need. Some institutions will say pediatric cuff, infant cuff, adult cuff. Some institutions will say small, medium, large, extra large. Know how to read your SPHYGMOMANOMETer on your blood pressure cuff. Make sure your equipment is clean. Make sure your stethoscope is clean. Make sure the earlobes are clean. They can be turned forward or backwards. When you go to the door, you knock. Note if your patient is on any isolation. Is my patient on contact isolation? I need a gown and gloves. For airborne and droplet isolation, we'll need your gown, gloves, mask. For patients with TB, you need your TB N95 mask. For standard precaution, gloves for all patients. We will prevent nosocomial infection. For standard precaution, you can use gowns if you're changing or bathing your patients. When you're doing blood pressures, you remove excess clothing. For patients who are neutropenic, you'll wear gown, gloves, and mask. There should be a sign outside the door of patients on contact isolation. Just check with the registered nurse at the nursing station before entering the room. We'll assist families and visitors with putting their isolation gowns on before entering the rooms. When you get to the door, you knock on the door before entering. You'll put the drape around the patients. You'll tell the patients the reason, identify yourself, tell them the reason why you're there. You'd like to check their blood pressure. You should do their 2 identifiers, ask them their names, ask them their date of birth. Patients who have had mastectomies, for example, the right arm, do your blood pressure in the left arm. For patients with AV dialysis grafts in their arm, if it's on the left arm, you'll do the blood pressure on the right arm. For patients with cast fractures, do your blood pressure in the opposite arms. We do not do blood pressure for patients with central lines. Do it on the opposite arm. Patients with blood clots, edema, lymphedema for mastectomy patients, we'll do our blood pressures on the opposite arm. For patients with continuous IV fluids, we'll do their blood pressures in the opposite arms. For stroke patients, right side, left side weakness, we'll choose the unaffected arm. For patients who do not meet these criteria, we will give them a preference. We'll ask them which arm would you like us to take your blood pressure in. They'll tell you which arm they would prefer having their blood pressure taken in. We'll give them a preference. We'll elevate their arm at the level of their heart. Their head should be elevated. We'll wrap the blood pressure cuff about 2.5 centimeters above the antecubital crease. we will this is your blood pressure cuff, and here when we inflate the cuffs, we have valves here that can open and close the valves. We have to close the valves in order to inflate our blood pressure cuffs. So the blood pressure cuff is around the patient's arm, that is elevated at the level of the arm, 2.5 cm above the antecubital crease. We'll palpate for the radial pulse. We'll feel the pulsation of the radial pulse. We'll inflate the blood pressure cuff, and on the sphygmonometer, wherever the sound of the pulse stops, we don't hear the pulse any longer. At that point will be your systolic. Say it's 120. We slowly deflate the cuff. We'll use this valve. We'll open it and deflate the blood pressure cuff. We will leave the blood pressure cuff on the arm. We'll pulsate for the brachial artery right there in the antecubital fossa. We will put the bell. This is not a professional stethoscope, you can see, but the bell of your stethoscope, you place it on your brachial artery. You place your earpieces forward in your ear. You will inflate your cuffs, your blood pressure cuff, right up to where you heard it. It was 120 when we checked the artery, so you inflate your cuff right up to 120. When you get to 120, you keep on inflating. You add 30 millimeters to 120. 30 plus 120 will inflate our blood pressure cuffs. An additional 30 will inflate it up to 150 millimeters of mercury. We will slowly deflate the cuff. When we slowly deflate the cuff, we'll be expecting to hear our first pulsation at around approximately in the ballpark of 120, because that's where we heard it when we palpated the radial pulse. When we hear that pulsation, we will deflate the cuff slowly, very slowly, the point of which we no longer hear a pulsation. We'll say that is at 80 millimeters of mercury. We will slowly deflate the cuff and release. And that's the end of our blood pressure reading. Our blood pressure for this patient was 123/80. When we palpated the radial pulse, it was 120. When we placed our stethoscope on the brachial artery and inflated our blood pressure cuff, we went up to 120. We add 30. We went up to 150. We deflated the pulse, and the first pulsation we heard was 123. We continued deflating, and at the point where we no longer heard the sound was at 80. So the correct reading for this patient's blood pressure was 123/80. We will release the blood pressure cuff from around the arm of the patient. We'll make the patient comfortable. We will document our blood pressure 123/80. We will clean our equipment. We'll make sure the patient is okay. Is there anything else I can do for you? We'll pull the curtain around the patient. We'll leave the call light close to the patient, the TV light, the person's belongings close by, and we'll don our gloves, our gowns, our masks, and we'll use the hand sanitizer on the walls, or we can wash our hands. Specifically, patients with E. coli, we have to, even although we use the hand sanitizer, we have to wash our hands. And that's a test-taking question. You have to wash your hands for all the patients we take care of who has E. coli. Contact isolation, C. diff. All the patients with C. diff, we will wash our hands. Thank you. Have a good day. Take care. I'll see you in my next video. Stay blessed.